Walaikum Salam. Thank you so much for inviting me and giving me a chance to speak on such a crucial topic, which is autism.
Amazing energy early in the morning. So to get started with it, obviously this is after a long time that we're coming back to speaking about where, with all such disorders, unfortunately, this news just came in that, that there's been a mushrooming growth. First of all, let's figure it out. Why is there a mushrooming growth? Number one. And number two, do you think that with the diagnosis part of it, we are lacking behind?
Yes, many people don't even know what is autism, and uh, most of the children they present with a speech delay. And most of the children they were not interacting with other children. They were not interacting with the parents, and mostly people they are unable to identify these problems at the right time. Mostly the grandmothers tell the parents that with age and with the passage of time the child will improve, don't worry, or people assume something else. There are a lot of assumptions and there are a lot of misconceptions about this disease. And most of the children who present to us in the clinic they present late, and that's why the result becomes late. If the diagnosis is late, then the result will be late, and the incidence is increasing day by day.
All right, Doc number one, obviously, I think with the incidence of it, obviously it has to do quite a lot with the genetics of it. But while we are at it, you just mentioned that unfortunately, if people are going to come or delay, the treatment of that child who's actually on the spectrum disorder, how do you think it will impact his overall health? Or, if we are to speak about the spectrum disorder itself, do you think that, for example, we say a stitch in time saves nine, do you think that it can be better if parents can recognize it earlier and then come and seek for help? It will be a better solution for them?
Yes, the early the diagnosis is made, the better will be the results. But as I told you, that most of the parents they are not able to recognize the early symptoms. That's why I'm very thankful to you for choosing this topic and giving me an opportunity to create awareness among the parents that please everybody should know the early signs of autism. Like if your child is not maintaining an eye contact with you, if your child is not speaking at the appropriate time, like by the age of 1 year, we expect every child to say mama and baba. By the age of 8 months, we expect every child to look into your eyes, and we expect every child to to see and to respond in the way when his name is called. Like he should move himself, he should look into your eyes, he should respond you, he should smile, and he should uh, make a social interaction. So what we observe in these children is that they do not interact properly, they do not maintain a proper eye contact, they don't give you proper response when the name is called, and they do not prefer to make friends, and the speech is also delayed. Mostly these children, they don't even speak a single word.
Right, and Dr. Junaid, in order to capitalize the conversation, because you mentioned a very important concept within the undercurrents of this conversation, and that is social interaction. So now I want you, because when we were growing up, there was no social media, there was no screen time, and it's said in the English, it takes a village to raise a child. But now that village has been replaced by a digital village, right? And that is why that social interaction is replaced by a digital interaction, and that is not harboring their senses more. So as a doctor, please explain to us, is there any connection between the screen time and the autism spectrum disorder, or is it just one of the myths that needs to be debunked? Please go ahead.
It's not a myth at all. It's very, very true that screen induces autism. These mobile phones, on one hand, they're making our life easy, but on the other hand, they are disabling our children. Most of the parents, they give this mobile phone to a very young child. Even I have seen mobile phone at the age of 6 months. A 6 months baby is holding phone, an 8 months baby is holding phone, because the parents want them to get busy and they can do their own work. So the continuous use of screen is creating autism. This is a well known factor which is proven by research. Even I have conducted research myself, and research have been conducted all over the world, that screen is leading to autism. Screen in any forms, whether it is cartoons, it is the games, or it is the iPad, whatsoever, any form of screen leads is
That's
leading.
exactly what I would, Doctor, that's exactly what I wanted to ask over here. Now, imagine that if you are going to go to the pre-COVID times, so 5 to 6 children will be on the autism spectrum disorder out of 10,000 children. Now, imagine that the figures are so staggering that almost 11.3% of the children out of 1,000 will be on the autism spectrum disorder. But when we are to kind of refer it with the screens and tablets and whatnot, where we say that, that the kid won't really be social, no eye contact, won't be speaking to you, do you think that all of these things are being caused by the devices that we give to our children, unfortunately?
Yes, although there are other factors as well, but screen is the triggering factor. Screen is just like doing what oil flares a fire. So screen is flaring up. Screen is triggering up the cases of autism. There are other factors, but screen is the most aggravating factor which leading to autism. And parents ask us why our child is using the screen, because I tell them, because parents are using the screen. When the child sees parents enjoying the YouTube, Facebook dramas, Netflix, so they also want to enjoy that. So if we want that our children should not use the screen, we also need to reduce the screen.
Absolutely. And Dr. Saab, once the child has been diagnosed with the autism spectrum disorder, so now tell us, how to deal with that child, because you say that that child has a limited interaction, or he's not interacting with the environment as much as a normal child should be. And I don't know what is the right word to say it out there. And how should a parent manage that children, and what sort of supporting environment we can provide to those parents and to those children out there?
Well, let's start the treatment right from the mother's womb. Whenever there is a pregnant lady and she's expecting, the first thing which she needs to do is to reduce the screen exposure herself. Even I have seen pregnant ladies putting the mobile phone on their tummy and sleeping for the whole night, and they are using Netflix all the time throughout the pregnancy. So please make sure that no pregnant lady should use mobile phone. This is a radiation has its own hazards. So the treatment starts right from the womb of the mother, and once the baby has been born, then you need to take certain measures right from the start. That first of all, give the breastfeed. Breastfeed reduces the incidence of autism. Avoid the toxins and unnecessary medication during the pregnancy time. Avoid radiations during the pregnancy time. And once, when the child is uh, about 6 months old, then start interacting with your child, start playing with your child, give proper time to your child, speak a lot of words to your child, make an eye contact with your child, do not give any screen to the child. And besides mother feed, after 6 months of period, give natural foods, no processed foods, no refined sugars, no artificial sweeteners. Give natural foods to your child. And when the child is about 1 year old, then you should give ample time to the child. Nowadays parents do not give ample time to their child. Give ample time to your child. Avoid unnecessary toxins, avoid unnecessary radiations. And if still your child is late in speaking and interacting, and he or she has been labeled as autism spectrum disorder, then you should start early intervention. Early intervention means early therapy. That includes speech therapy, that includes behavioral therapy, that includes occupational therapy. There are therapists in we have therapists that can give your child ample amount of time daily, and through therapy they actually modify his or her behavior, and they they teach child how to speak, and they teach how to do important healthy activities like writing, like coloring, like improving social interaction.